Eustachian tube. It is a osteocartilaginous tube beginning from the anterior wall of the middle ear cavity connecting to the lateral wall of the nasopharynx. It is approximately around 45 millimeter in length. The lateral two-third of this eustachian tube is bony since it is related to the petrous part of temporal bone. The medial one-third of this eustachian tube is cartilaginous. It is related to the nasopharynx, which is also a soft tissue. So this eustachian tube, main function of this, because it connects the middle ear cavity to the nasopharynx, it helps in ventilation of the middle ear cavity. When we yawn, when we do Valsalva by taking a deep breath, no, if you try to blow out, the air will enter your middle ear cavity. So tympanic membrane is optimum in position if the air outside and inside the tympanic membrane is of same atmospheric pressure. Therefore, ventilation of the middle ear is provided by eustachian tube. This tube connects the pharynx, lateral wall of pharynx, to the middle ear cavity or tympanic cavity, therefore also called pharyngotympanic tube. It is also called as salpingo and simply called as eustachian tube because it was discovered by Dr. Eustachian. Also, the secretions in the mucous membrane of the middle ear will be drained into the nasopharynx through the eustachian tube. So, provides two important functions. One, ventilation of middle ear. Second, drainage of secretion. Any abnormality in the opening and closure of eustachian tube results in accumulation of the mucus within the middle ear, resulting in otitis media. The condition is called eustachian tube dysfunction. The consequence of that is otitis media. If the ventilation of the middle ear is affected, the tympanic membrane will get retracted, it will be pulled inwards, that will cause decreased hearing, that is hearing loss. So these eustachian tube muscles acting on eustachian tube, these are the muscles which are around the eustachian tube. Actually they are muscle belonging to soft palate and the middle ear and the pharynx. The first muscle is tensor veli palatini. It begins from the anterolateral aspect of the apex of petrous part of temporal bone and goes and takes a hook around the pterygoid hamulus, gets attached to the palatine crest. It tenses the soft palate, therefore called tensor palatini. Since it begins from the anterolateral aspect of the cartilaginous part of eustachian tube, contraction will cause dilatation of the eustachian tube. Like in yawning, it causes dilatation. Next, levator veli palatini begins from the medial aspect of this apex of petrous part of temporal bone. It descends downwards and gets attached to the upper surface of palatine aponeurosis. It causes elevation of soft palate, therefore called levator palatini. It's called veli because action on the eustachian tube, it dilates the cartilaginous part of the eustachian tube by pulling it medially. Tensor veli palatini pulls laterally, levator veli palatini pulls medially. So both of them will dilate the eustachian tube. Next muscle is a muscle of pharynx. It's called salpingopharyngeus. It begins from the inferior aspect of the cartilaginous part of eustachian tube, goes and gets attached with other muscles, that is palatopharyngeus and stylopharyngeus, to the posterior border of thyroid cartilage, that is salpingopharyngeus. Since it begins from eustachian tube with surface, lower aspect, it pulls that and helps in dilatation of the eustachian tube and therefore helping in yawning or ventilation of the middle ear. The last muscle is tensor tympani. It is a muscle of larger muscle of the middle ear cavity. It tenses the tympanic membrane. It begins from the anterior wall of the tympanic cavity and goes and gets attached to handle of Malleus. Handle of Malleus is pulled inwards, the tympanic membrane will get tensed. In addition, acting from this side, that is Malleus side, it can pull the eustachian tube, helping in a dilatation of the eustachian tube. Normally, when we close our mouth like this for 30 minutes to 45 minutes without opening it, the air inside the middle ear will be used up by the cells of the mucous membrane of the middle ear. Then we end up doing this. So we are yawning. So yawning is a process in which gush of air, tornado of air is entering the middle ear, so that the tympanic membrane, because of lack of air, it could have become like this. It could have become like this, tensed. It is not in optimum position. When air enters the middle ear, it will become optimum. So whenever you yawn, most teachers feel that you are actually sleeping. Actually sleeping person never yawns. When you yawn, actually you are trying to hear the teacher well by ventilating the middle ear. So if you are knowledge enough, try to tell your teacher in a polite way so that the teacher will be impressed by your knowledge. All these muscles, the tensor veli palatini, levator veli palatini, are supplied by vagus nerve, cranial part of the vagus nerve. and some authors believe that it is supplied by accessory nerve. The sulfingopharyngeus is supplied by vago accessory complex. The tensor tympani is supplied by mandibular division of trigeminal nerve. Through the nerve to medial pterygoid, the tensor tympani is supplied. So this is in detail about the eustachian tube. Hope it benefits. Thank you.